So you got blood circulation problem in your legs if you're diabetic? This is very important topic. The risk factor for peripheral artery disease are similar to those that promote development of coronary atherosclerosis like smoking, hypertension, hyperlipidemia, diabetes, and metabolic syndrome. Hello there, this is Dr. PK from DrPKlyfe. Today I'm going to talk about blood circulation problems in legs in diabetics. So you got blood circulation problem in your legs if you're diabetic? This is very important topic, and I cannot begin to emphasize how many times I've seen patients losing their limb because of poorly controlled diabetes and peripheral vascular disease or peripheral artery disease. The risk factor for peripheral artery disease are similar to those that promote development of coronary atherosclerosis like smoking, hypertension, hyperlipidemia, diabetes, and metabolic syndrome. Other factors include age, sex, ethnicity, family history, genetic influences, and possibly homocystinemia. There are some identified differences in risk factors for PAD versus coronary artery disease, CHD, which may indicate subtle differences in pathophysiology. Sex-related differences in prevalence of peripheral artery disease, PAD, has been documented, with PAD cited historically as more prevalent in males compared with females. However, the population-based prevalence of PAD in females has not been fully evaluated. The prevalence of PAD in females is at least as high as that of males across all age groups. High-risk groups. American College of Cardiology and American Heart Association guidelines on PAD identify the following at risk for lower extremity PAD. Age more than 70 years, age 50 to 69 years with a history of smoking or diabetes, age 40 to 49 with diabetes and at least one other risk factor for atherosclerosis. Known atherosclerosis at other sites, for example, coronary artery, carotid artery, or renal artery. Diabetes is a complex metabolic disorder and it affects various aspects of health, including blood circulation. And for diabetic patient, monitoring circulation is crucial. Poor circulation can lead to serious complications, particularly in the extremities. And one such complication is diabetic neuropathy. This condition affects the nerves, often causing numbness, tingling, sharp shooting pain, and it's a direct result of poor blood flow, especially in the feet. The blood supply to the nerves are affected with diminished circulation, thus damaging the nerve, and that tiny blood vessels called vasa vasorum, and they are blocked, they are damaged. So nerve don't get circulation, so they die because of lack of enough blood. But why is circulation so important, and how does diabetes impact it? This video aims to answer these questions. It will delve into the link between diabetes and circulatory problems. It will explore the symptoms of poor circulation and neuropathy. Moreover, we'll discuss the risk associated with poor circulation in diabetics. From diabetic foot complication to vascular issues, we're going to cover it all. Finally, we'll provide actionable advice. You'll learn about lifestyle changes, medical intervention, and daily precautions that can help prevent vascular insufficiency. Understanding these aspects is vital. It empowers diabetic patients to take control of their health and prevent serious complications. So let's get started. So understanding diabetic circulation problem. Diabetic individuals often face challenges related to blood circulation and neuropathy symptoms, which can lead to serious health complications. Understanding the significance of addressing poor circulation and diabetic neuropathy is crucial in managing diabetes effectively. In this video, we're going to delve into the complexities of diabetic circulation issue and explore solutions to enhance blood flow and prevent circulatory problems. And let's navigate through the realm of diabetic feet care and the vascular issues to ensure optimal health outcome for individuals dealing with diabetes complication. Diabetic circulation problems are common and they stem from the impact of high blood sugar levels on the body's blood vessels. Over time, high glucose levels can damage both large and small blood vessels, and this damage impairs the body's ability to circulate blood effectively. And the extremities, particularly the feet, are often the first to be affected. The farthest part of your body. Reduced blood flow to these areas can lead to a host of problems. So, how exactly does diabetes affect blood circulation? It's because of uncontrolled blood sugar, and that leads to several changes pathophysiologically, and then the blood vessels are damaged and they can transport blood effectively, and the circulation is compromised, especially in the areas farthest from the heart like the feet. And diabetes mellitus is characterized by hyperglycemia, dyslipidemia, and insulin resistance. And diabetes mellitus is a powerful risk factor for PAD and is second only to cigarette smoking in contributing to the magnitude of increased risk of PAD. Among the more than 10 million people in the United States with PAD, approximately one third have diabetes mellitus. Compared with general population, the prevalence of diabetes mellitus is higher, but PAD prevalence may still be underestimated in patients in diabetes due to the asymptomatic nature of less severe PAD and often concomitant diabetic neuropathy. The prevalence of PAD is approximately doubled or more in those with diabetes compared with those without diabetes. In a large multinational meta analysis, the presence of diabetes mellitus among participants in high income countries was associated with nearly a twofold increased odds of PAD. The Enhance study reported an increased risk of PAD in patients with diabetes, a level of risk exceeded only by smoker. A prospective cohort study with more than 20 years follow-up found an increased risk of death for patients with diabetes and PAD compared with those without diabetes. The prevalence of diabetes increases with age, as does the prevalence of PAD in those with. Among individuals with diabetes mellitus older than 70 years of age, attending outpatient medical or vascular surgery clinic in Spain, PAD was detected by screening test where ABI was less than 0.90 in more than 70%. In addition, among patients with PAD undergoing lower extremity revascularization, approximately 50% had concomitant diabetes mellitus. And diabetes mellitus may be a more significant risk factor for females for the development of claudication. In a review of the Framingham study cohort, diabetes mellitus in the presence of glycosuria, which is high blood sugar, increased the risk of claudication nearly ninefold in females versus three and a half fold in males. The underlying metabolic abnormalities in diabetes enhance vascular inflammation, endothelial dysfunction, vasoconstriction, platelets activation, and thrombotic risk, which impact the development of PAD. The pathogenesis of atherosclerosis is similar for those with and without diabetes. However, the underlying metabolic abnormalities, diabetes mellitus enhance vascular inflammation, endothelial dysfunction, vasoconstriction, platelet activation, thrombotic risk, which impact the development of PAD.